Dennis Lawrence, Sports and Regenerative Medicine. Today we're going to talk about multi-joint AVN. We have patients that are quite complicated. I get avascular necrosis patients from all around the world. Most common cause of AVN is traumatic, and usually that's in one joint. But there are other types of disease states that lupus, rheumatologic conditions, excessive corticosteroid use, even radiation therapy or chemotherapy can cause a loss of blood flow to multiple joints, so the AVN can show up in multiple areas. And I've seen that occur in a lot of complicated patients. The most common presentation is bilateral hip AVN, but you can also have it in a hip and a knee, a hip and an ankle. The shoulder can be involved. There can be many different presentations. This is an illustration of a case of multi-joint AVN, and we're looking at the knee, and this is the femur and the tibia. This blackened lesion here is an area of avascular necrosis in the knee. So that is a clear indication of the necrotic lesion. And then hip, the top of the femur here is the femoral head. We see this really nicely demarcated black area, which is the area of necrosis. So we have it in the femoral head and the bottom of the femur where it articulates in the knee joint. So two separate joints. You also have to be suspicious and always look if it's in that pattern, whether it's going to be in the other hip as well. So having a high index of suspicion for other things and understanding AVN is crucial. I've dealt with AVN of all types, and it can be complicated, but I've addressed most of these issues, and we've had very good results with treating some of these patients with regenerative medicine. Thank you.